My name is AJ Doan. I'm a journalist in Western Kansas. I've written an article about the connection between caregivers for people who have dementia and Alzheimer's and providing care for them. There are some solutions being found through an agency in St. Louis that's helping people come to terms with their role as caregivers and coaching them along the way. It's been observed that people in caregiving roles, they often kind of stop taking care of themselves. That's a national trend, both for seeing the number of patients with Alzheimer's and dementia climbing, but also the number of people caring for them. Dementia and Alzheimer's is an everybody problem. There's an agency in St. Louis called Memory Care Home Solutions. They provide coaching and support for caregivers, people who are helping out their loved ones, and they specialize in those dealing with Alzheimer's and dementia. They're called navigators. They work like case managers, but navigators is a better term to describe kind of the process that they take people through to coach them into being more effective caregivers and to learn how to care for themselves at the same time. Most of the staff of this agency, they have lived experience. There's about 18 navigators in this memory care facility that help out about 50 people per week. Sometimes it's a simple check-in to a home tour to see how they can make homes safer for people. So some of the successes that they're finding is that more people are able to stay at home as they live with Alzheimer's and dementia. The goal that Memory Care Home Solutions always has is to allow people to remain at home comfortably and not have to be transferred to some sort of care facility. Something that I thought was really interesting was some simple electrical tape, a strip of black electrical tape on your white surfaces in your bathroom that helps a person with dementia see that better, understand the space better. And that's just one example of the many little things that navigators will do to help their clients live more healthy lives and live safer lives. Some of the testimonials that I've read and some of the conversations that I've had with people have borne out the fact that this is a necessary service that they're providing. Word of mouth has been their best support network, if you will, for not only educating people in the community about what they do, but also bringing in new clients. So really the evidence that this is working is the demand. They serve hundreds of individuals, thousands of families across the greater St. Louis area and in fact, eastern Missouri and into western Illinois, actually. But the demand is growing. They're seeing a lot more people showing up to their open houses, just wanting to learn more about Alzheimer's care, dementia care, how to be a better caregiver. And they're doing so in a way that's very personable. And that is helping garner more success, but it's also because of that word of mouth that's traveling quickly around the region that there's an agency here that can help you if you're struggling as a caregiver. They're offering more educational opportunities, more programs on a broader scale for community members to get an introduction into some caregiving tips and tricks. What is not being solved right now, I think, is a lot of the societal stigmas that come with Alzheimer's and dementia. That's something that they work with people on an individual basis. Right now, they're really just focused on getting the job done. The main limitation that I think they face is the number of staffers that they have versus the caseload, and the caseload continues to grow every day. They're trying to adapt to meet the demand for their services because of those increasing dementia and Alzheimer's cases. Communities everywhere could learn from the Memory Care Home Solutions example of one-on-one care on a citywide scale. And obviously they've realized they need to grow because the city has realized that they're a very helpful asset. And not only the city of St. Louis, but the entire region. There's a lot of people that cross over into Missouri to receive services. The bigger goal, according to memory care staff, is to make sure that the public knowledge about Alzheimer's and dementia has increased, the awareness has increased, and that people don't feel guilty about their caregiving position. Caregiving is stressful. They can learn just how to start offering that care, offering that support. Receiving a dementia or an Alzheimer's diagnosis, it can feel like the end of the world for a lot of people who get it, and it can feel lonely. The folks at Memory Care would like people to know that that's not how you should go through life. You are not alone in the fight against the daily ravages of dementia, because it is a daily cognitive disease. It's something that affects the people who have it every minute. And it can be difficult from their family to understand that. And it can be difficult for family members who don't see that person very often to understand what's happening to them. Dementia has a ripple effect throughout a family, throughout a community. And there's many, many more people out there who are providing care for folks with dementia or Alzheimer's that maybe every day is a new challenge and they're not entirely sure if they're going to make it through the next day themselves. They need to be aware that they are not alone, that they can receive help, they can receive support in their own way. They can get that where they're at in their community. People should know that they should not feel burdened by that stress. Again, you cannot pour from an empty cup.
This story was produced through the Missouri Solutions Spotlight Project, which receives funding from Missouri Foundation for Health. Articles for this project were developed by regional journalists working independently of the foundation and supported by the staff of the Journal, a solutions-oriented nonprofit news outlet based at the Kansas Leadership Center. The foundation had no editorial involvement, including no control over the selection, focus of stories, or the editing process of Missouri Solutions Spotlight. Funders also do not review stories before publication.